Dentigerous cyst, also known as follicular cyst, is derived from reduced enamel epithelium which surrounds the crown of an unerupted or impacted tooth. This reduced enamel epithelium consists of a layer of ameloblast and outer enamel epithelium. Dentigerous cyst develops as a result of fluid accumulation between the reduced enamel epithelium and the enamel surface. Dentigerous cyst is attached to the cervicoenamel junction of the tooth. As this cyst is derived from the reduced enamel epithelium which surrounds the impacted tooth, so dentigerous cyst always includes the crown of either impacted or unerupted tooth, with the most common teeth being the third molars. The most important clinical symptom of dentigerous cyst is the painless expansion of the jaw. It might be associated with pain if the cyst gets infected. The peak incidence of its occurrence is in 20s and 30s. In first 10 years, it is relatively rare. However, it can occur in 4 to 9% of the cases. If this cyst presents in early ages, most commonly it is associated with the periapical inflammation of a non-vital primary tooth. Periapical infection can cause inflammation of unerupted tooth. In radiography, this cyst appears as a unilocular radiolucent cystic lesion with sclerotic borders and is associated with impacted or unerupted tooth. There are 3 variants of dentigerous cyst: central, in which the lumen of the cyst is in center of the tooth; lateral, in which the lumen of the cyst lies just lateral to the tooth; circumferential, in which the cyst surrounds whole of the tooth. However, the cyst is always attached to the cervical margin of the tooth. Now moving into the histopathology, as like other cysts, it has a lumen, epithelium and a connective tissue capsule. In case if the cyst is non-inflamed, the epithelial lining will be 2 to 4 cell layer cuboidal, non-keratinized, and there are no retipi. And the connective tissue is fibrous without the presence of inflammatory cells. In case if the cyst is inflamed, the epithelial lining is non-keratinized, hyperplastic, and the presence of reti ridges. The connective tissue of the inflamed cyst is fibrous, composed of chronic inflammatory cells, cholesterol clefts, and rushton bodies. The treatment of the tooth having the dentigerous cyst is the enucleation with the removal of the associated tooth. However, Marsupilization can be done if the associated tooth is to be retained. Now let's discuss a case presentation. A 27-year-old female presented with painless expansion of the jaw. Radiography shows unilocular lesion which is attached to the cervicoenamel junction of impacted mandibular molar. So the diagnosis is dentigerous cyst. If you found this video helpful, don't forget to like it. Thank you for watching.